Hello, friends. Welcome to Feeling This Life. We're a family support podcast that dives deep into the triumphs, challenges, and strategies that are part of the lives of those who care for children with blindness and visual impairments. I'm Paige Maynard, and I'm a teacher of the visually impaired and an early interventionist at VIPS, Visually Impaired Preschool Services.
And I'm Dr. Cathy Smith, and I also have been a teacher of students with visual impairment for many years. And now I am the Director of Research at Anchor Center for Blind Children.
I am jcastenir, and I am the Family Services Coordinator at VIPS. I am the mother of 3 girls, and my youngest has a visual impairment.
So today we're actually just going to talk to each other because we think it's really important to have a session on assessments and evaluation and why do we really need them. So I'm going to start talking about the different kinds of assessments, and it's important to know, I think assessments and evaluations have kind of gotten a bad rap in the past couple of years because high stakes, is your school good, are your teachers good, who's doing the right thing, and it depends on whether teachers get raises or move forward, and all those things are kind of scary, and I think a lot of parents choose to opt out, and we just think that assessments are scary, and they're not. They're very important because the truth is, why do we need assessments and evaluations? Because they guide instruction. So that's what we do, so we know how to help kids. And there's different kinds of assessments. So those high stakes state tests are not what we're talking about today. We're talking about things that are just about your child, whether they're developmental. So what's a developmental assessment? It's something that's looking at where is your child and what can they do. And these are super important even in the birth to 3. Do you use developmental assessments, Paige?
Yes, we absolutely do. Because I work in Kentucky and we work through our early intervention state program, we have several different developmental assessments that we are allowed to use as part of our work with our families. One of those is the Carolina curriculum. There's also another one called AEPS, another one with the name by the help, but really all those names are not really all that important, I think, unless you just want to know as a family. But it's a good thing to know why those assessments are happening and what information that they're going to be giving you, because we're really looking at what types of things is your child doing, what skill set do they have, how are they participating in daily routines, how are they participating in play, and those sorts of things. So there are lots of different ones that are out there, and it's good to remember why exactly we're doing this. Another one as well for children who are blind and visually impaired would be the Oregon Project, and that one's actually a skills inventory, but that's right. Another one that we use as well that I really like, because it accounts in the way that development occurs for children who are blind and visually impaired.
Right. So I think most parents might know what a developmental assessment is because when they go to the pediatrician's office when their baby is young, every time they go, hopefully your pediatrician gives you some kind of parent input form, like what are the milestones that your child's meeting. That's really what a developmental assessment. Jenny, have you had experience with that with all of your children?
Yeah, I think, starting out when they're young, it was all kind of the same for, our sighted kids and our visually impaired kid, just looking at those like specific milestones that you talked about. But as she's gotten a little bit older, hers are a lot more I feel like intensive than the other girls. Like there's more questions to it. It takes a little bit longer. And I used to get stressed out about it because it made me think, are we not doing something right because she didn't get this like check marked the way they would like for it to be to say that she's like on track or whatever. But then I started to look at it as, well, like that never even crossed my mind, like what that question is, like kind of how Paige was talking about, like your daily routines. Well, that never even crossed my mind that we should be talking about that or working on that with her. So I just try to use it as like a reminder to myself of other things that are out there, because I think you just get so overwhelmed with everything.
Sure.
But yeah, I feel like she's had so many, like I couldn't even tell you this is the ones she's had. Like it's just like paperwork.
Yes, right, right.
Oh, yep.
Here's that thing I gotta fill out again. Yes. Yeah. So, but they are important, right? So why are developmental assessments important? So, like Paige said, to help with looking what they're doing in their routines, but also for the pediatrician's sake to say, oh, is there a concern here? Do I need to make a referral? Do we need to get this family help? So that's another reason to do those. We should be doing them on all children, not just kids with visual impairment. Here's the tricky piece, and here's the researcher in me, right? Here's the tricky piece about kids with visual impairment. So when they create these tests, often children with visual impairment are not included in the sample. And so some questions, if your child has a significant visual impairment, your child is never going to meet that goal. So some babies are never going to make eye contact. Some babies are never going to reach for things. That doesn't mean that their development is not progressing, but some people get, so then we have issues with validity, and we'll talk about that a little bit later. And I think it's an ongoing problem in our field that, what's the right developmental assessment to use? And I think parents should think about it as, my child is a child first, and development follows specific timelines and goals. And if my child's not meeting those goals and timelines, then we need to know so that we can help either adapt or improve their functioning in the area of that. That's why it's important. So we need good developmental checklists that don't say, oh, your child is functioning at a 6-month level. We need ones that saying, here's where they're functioning, this is what we're doing, these are the next steps. So that's where development needs to happen. The other kind of assessment that's used more frequently, maybe in preschool, maybe not so much, is progress monitoring. But you can think of your IFSP as a progress monitor assessment almost. So here are the goals. Did we, every 6 months, we go through and say, did we meet these goals? What did we do to meet these goals? Can we go on to another goal? So all those kinds of things are progress monitoring. There are some progress monitoring tools that work better for kids with visual impairment than others, but both of those kinds of assessments help teachers figure out what to do and help parents figure out what to do. They are not high stakes. How does your kid compare to everybody else in the state? That's not what we're looking at. So I think it's really important. So my dissertation was validating a test for vision impairment, and it was a process, and what I learned is that I should have done my dissertation on why are TVIs afraid to give tests. I don't want to give tests. I don't, they would have me come out to the place to do it, and then I would do it with the kids, and they'd be like, oh, I can do that. And I'm like, I know you can. Why did you not want to do it yourself? And I think it's this fear that we don't want to tell parents that their child is not doing what they're supposed to be doing, or or we don't want to be graded on how well we give tests, and nobody wants that. But I don't think that's the purpose of assessments.
Mm-hmm. One
It's
thing
yeah.
I was just gonna share about the feeling part of this is I often, as a teacher, I'll feel that weight of, yeah, I know this assessment is going to score this child low in the cognitive area because every single cognitive item is about finding something under a blanket, and the child, they
Yes,
can't see the blanket, and
that's right.
honestly, who cares? But it's, I feel like many of us who are teachers oftentimes like feel those emotions of our family. So I hate to share that information that, the child scored in this way on the assessment, but I like how you said it's really in a lot of ways not necessarily about that. It's about how do we help them, and how do we find the tools and find the providers that we need, and that sort of thing. So I'm curious if, like, for you, Jenny, like, for your situation, like, did that ever happen, and how did it make you feel when maybe that it did or didn't, with the way that something was scored, and you're like, well, she's visually impaired. Does that ever happen?
Yeah, definitely. And it's something that at first was really frustrating to me. It was usually timed things. She shouldn't really be doing anything timed, but they're really stuck in school on how many words you can read per minute, and, things like that. And we would, it's on her IEP that she shouldn't do anything timed, but it constantly comes on the report card. And it drives me crazy because it's always the big, like, not meets expectations. And I'm like, can they not just not answer that? Like, why does that have to be on there? Because we know that she's never going to hit that. And it just really drives me crazy that it's always on there still. And I know that's silly because, I talk to her teachers and I know that they understand and I understand, but they still kind of have to follow the process and do it. So I think that might be kind of what you're saying, Paige, where, you have to score them this way on this. But I think for parents, if they have a concern, just talking to the teacher can make them feel better, just to understand
Yes.
why a teacher has to follow certain criteria and do it. But on the other side, I know your kid. Here's where we are. Here's what we're doing. And that it still gets on my nerves, but I do understand, and it makes me feel a little better. I don't know. Is that what you meant?
Yeah, and well, and I also, this is a completely different episode that will probably happen in the future, but it also makes me think too about how so many of the families that I work with, I know every time that I present an assessment report, it's going to open up their grief again, because here it is on paper again that my child's not like the other kids. And yes, they are a child first, so let's, make sure we establish that, but it can be so emotional. And so sometimes as a provider, like, I feel that with you. So if your family listening, if you're one of my families, like, I feel it with you. And I absolutely hate it because I know that your child has good cognitive skills and good problem solving skills, and they don't have to be able to find something under a blanket in order for me to think that they're smart. So they are. And a lot of times I'll share with my families too, like, this is just this assessment. When your child is 35 and they're doing their thing, nobody's gonna care that they used a fork when they were such and such months old. They're gonna do it on their time, and we're gonna celebrate it when it happens. And just because maybe it happens a couple months different from somebody else does not mean that your child's experience is any less valid, and that your parenting is not as good as somebody else, because you're giving everything that you have, and I'm here with you. So anyway, sorry,
Absolutely.
I had to hop off the soapbox there, but that's how I feel about assessments.
I think too, like, kind of along the same lines, even if you have a child without a visual impairment, there are still times where they're not meeting things that they should, but then they catch up. And sometimes you don't even know what the issue was, but then one day, like, lights on, like, they get it and they can do it.
Yeah.
But I don't know if it's something about the word assessment or test. I know you said we're not doing this standard, but we're not talking about state tests. But, like, even my middle daughter in first grade, she was so stressed out over testing. Like, she was convinced that her teacher was going to get fired if she did bad. And, like, I just finally had to tell her, like, I probably shouldn't say this, but I finally had to tell her, like, I don't care how you do. Like, just go to school. But, like, it was just from the beginning, like, that just so much stress put on it. Like, she was even like, I
Right.
love my principal and he's going to get in trouble if I do bad. But I think sometimes these parents that really care and try so hard are the ones that get more crazy about the assessments
Right.
because, like, I kept telling her, like, you're not the kid they're talking to.
Right.
Like, you do care. You're going to do your best. They're talking
Right.
to, like,
Right.
whatever kid that could care
Right.
less.
Well, and I think, and that's exactly. So this is it's a big cycle, right? And a lot of people are like, well, I'm just not ever going to have my kid take the test, and then, but that's a problem. That's a problem because then teachers and we do not know where they are. So I think that's why we're having this conversation so that parents know that it's not the end of the world, and some teachers and some schools deal with it differently. So you just need to, I mean, I used to send my son off on testing week and say, have a good breakfast and do your best. And that's all I expect. And if you do great, that's fine. If you don't do great today, it's okay too. All of us have bad days. So Jenny, I want you to think about. I understand that it must be frustrating every report card to see that and hard, but that is your piece. That if you ever go to an IEP meeting and they say, "Oh, I mean this whole season we're talking about kids who don't look like they're visually impaired, but they are," so that is your piece. That is your data. That is what you can say. Yes, she does do well in this, and this. But look, she's not meeting expectations in those. So that's your evidence. And that's what I see as a researcher. So even though those things are hard, those are what's going to keep getting her help.
I like that. That really does make me feel better because we do have issues sometimes with her not being able to get what she needs because people forget. She does compensate so well.
Let's talk about what different places look like for different assessment.
This was really interesting to us and frustrating, but Hannah has, her regular ophthalmologist appointment and she has low vision clinic. The low vision clinic is what allows her to get, for lack of a better word, a prescription for the items that she needs for school, whether it be her Jupiter, her monocular, her magnifier, all that. And then the ophthalmologist is just her doctor. So we went, I think there was 6 months in between, and she had her low vision, and I was just so impressed. I loved every minute of it. I felt like I understood more about her vision after that than I ever had before. Because if you've never done a low vision clinic, basically they watch your child do different tasks, or they have your child do different tasks. So the ophthalmologist that was in the low vision clinic had her read a book to her using a magnifier, then read a book to her using, a Jupiter. But it was real world. Like, she moved around the room. She didn't sit in one spot. It was real world her. Like, she even was able to have her little side conversation that, she likes to talk to people. So she'd even have her personality and do her own normal little thing and then go back into what she was doing. But it was a real world situation. So I just felt really good about that. And I felt like we had an understanding. I felt like we had documentation that really helped, and that it was like very easy to read and understand. It wasn't like very medical terminology. Like, I could really understand it. So then we go fast forward 6 months down the road, and we go to her doctor, and she gets a vision score that it was like 20 point, like 20 over 20. It was like 20 points, like, better. I don't know how to say that. A lot better. And my husband and I are just looking at each other like, there is no way she can see that. And I'm looking at her, and she's squinting and leaning as far up in her chair as she can, and she's really trying to find those letters on the Snellen chart or whatever. And I just think to myself, like, this is not normal. Like, she's in this perfectly lit room that has no changing light, nothing. It's just this perfectly lit area. The words that she's looking at are not moving. Nobody around her is moving. We are all just sitting there, letting her take her time to read. And that's just not real world. Like, there will never be a time in her life when she just sits there and has everything controlled around her the way she needs so that she can take a test or so that she can do some kind of recreational activity. And I just left super frustrated that now I have these two reports, and people put so much more weight on the doctor one, because even though they were both done by an ophthalmologist, I don't know why people that aren't in the field, or, like coaches and stuff that need the information, they're like, oh no, I can't take this low vision report. I need a doctor report. And it really takes some education to say, like, this is like an ophthalmologist did this report. And it's really frustrating.
I feel frustrated with you, Jenny.
Me too.
And there are definitely reasons why those two different ways of looking at her vision exist. But for me, I've shared before on this podcast that I had a very severe eye injury, and I have a cornea transplant, and I am very light sensitive. And when I go to the eye doctor, it's like a good day whenever I sometimes I can read the 20/20 line, sometimes it's the 20/25 line. But even like with me, they say, have a great day, you're doing great. But when I go out into the world, I'm not sitting in a doctor's chair looking at 3 letters in the dark. I'm trying to drive my car and find the street sign, or the sun's behind something, and now I can't see it anymore because it's super bright. So that's so frustrating whenever it's just boiled down to like one number on a paper, when like nobody sits in a chair and reads EVOTZ2, for their job.
And some of us obviously memorize that.
That's right. Some of us have. I have read that. I have read EVOTZ2. I'm sure many people listening to this have children who will probably be able to recite that. And maybe your doctor's is not the same as mine, but my doctor's has been EVOTZ2 for like ever since I had an eye injury, which was about 10 years ago. So
I used to get frustrated before she knew her letters with the pictures, because it would always be like house, tree, and they did it the same way every time. And so then they'd go through it again, but in the same order. And I'm like, she's just memorizing it. Like,
yep, the adults do it too. Yep.
And so then they're like, oh, it's, great, good job, check mark, good vision.
Yeah, so. And you're like, no, just good memory.
which is another thing that we've learned, right? So my child has a good memory, so they're compensating that way. So
I think I've had to learn, which I'm still learning this, obviously, because this was just like 2 weeks ago that all this happened that I'm complaining about. But I have to quit thinking about how it makes me look, and quit worrying about what people think of us. Because I'm like, oh, well, do they look at that report and think that we're lying? Or like, do they do, and it, like, I have to quit and just realize, like, it is what it is, but I have to fight and do what's best for my daughter. But it is really hard.
Mm-hmm. Yeah, I see that. Yeah, it's interesting. Well, this is a perfect segue to the next question, which is, it's not really a question. So about what is a functional vision assessment or evaluation. And before we go any further, I would really love Paige to talk to us about the difference between those two words and what do they mean?
Yes. An assessment is us looking at how does your child compare to other children, or how do they compare to something. And so we're comparing them. But an evaluation is a little bit different in the way it kind of gives a little bit more of like a holistic picture, and it looks at, let's just describe everything about your child.
Hey everyone, here's Paige in editing. Just wanted to get some clarification
on the difference between assessment and evaluation. So, an assessment is the evaluation or estimation of the nature, quality, or ability of someone or something, whereas an evaluation is the making of a judgment about the number, amount, or value of something. As far as the definitions, according to special education, we might think about an assessment being a specific tool and an evaluation being an overall collection of information.
Sometimes we need to do assessments because, again, we need to know where your child is developmentally. And that includes what is our expectation for vision skills or whatever. So no, I think that's and again, it's all about words, right? Words matter, so we need to be good about that. So if what you're doing as a teacher of students with visual impairment is really a functional vision evaluation, then that's what you should say. But I think parents will find that depending on where they live, people will use different terms and do different things. So some people say assessment and are doing an evaluation. I guess that's what I'm trying to say. But I think it is good to it's a great question to ask, right? So are you doing an assessment on my child? Are you doing an evaluation on my child? And what does that mean? So it's a great question to ask if you're a parent.
It is, and you'll impress your teacher as well.
Because then they'll have to go look it up, right? Right? So one of the things that I wanted to point out before, and we can talk about much more about functional vision, is that because that's what Jenny was just talking about, right? So her, there goes the snowplow. Sorry, let's wait. So that's what Jenny was just talking about, is that her daughter, her ophthalmologist in the doctor's office, is doing an assessment, is doing standardized tests that have scores and tell you specific information that is the same that we do with everybody, okay? And her ophthalmologist in the low vision clinic is doing an evaluation. So looking at the environment and looking at the changes in vision and what is, trying different things. That's an evaluation, right? That's great. So here's the downside in our field. Research shows that there is absolutely no consensus in the necessary items in FVEs or FVAs. So everybody does their own thing. Not only that, what we teach teachers of students with visual impairment are all different. So every school that has a program in vision teaches their teachers differently. This is a problem. So we're starting to look at it. There's some articles coming out we're starting to have these conversations in the field about how can we do things a little bit better so that we're more consistent, because if you move from state to state, you're gonna see a totally different thing in what you get. And this is the primary job of a teacher of students with visual impairment. This is our job, is to figure out what your child's functional vision is and how to adapt for that and how to help them use it. That is our job. We need to, do we standardize it? But then if we do, then we have that risk of, are we going to end up doing what doctors do? So I think there's a midway point. We can do a little bit of both. And I just think it's good that we're talking about it. Do you have feelings about this, Paige?
At VIPS, we are working toward making sure that our functional vision evaluations encompass all of the areas that they need to. And I'll tell you, as a team of people who have been trying to work on what are the things that we really need to be looking at in kids who are birth to 3, because that'll be the majority of our evaluations. And it has really been eye-opening as far as the amount of things that we can look at and the amount of things that we can observe and evaluate. And there have also been lots of conversations with our team members, because even among the VIPS team, I would assume in the Anchor Center team as well,
Yes.
not everybody agrees. And so there've been lots of good productive conversations around that, but we're still working on it, and one day we'll get there. Right now we're not there yet, but we're going to do the best we can. And our goal, I would hope, as the full community, I'll tell you that my goal as the teacher is that I want you to come away from that evaluation and the evaluation report knowing more about how your child uses their vision, and the things that make it difficult to use their vision, the things that are difficult for them to do, or also the things that are their strengths as well. And if I have done my job, then you will be able to know those things. So as far as, like, what can we encourage families to do when we're going over the report and those sorts of things, what I would encourage you to do is, please ask questions. Please make it a learning experience for you. Like with early intervention, that's what we're doing, is we're educating you, and that report is a tool to do that. So
I'm sorry, I had another snowplow going past. It's like, really? Really? So, yes, exactly. And I think that's a great segue. So, Jenny, why do you think that parents of even very little children? Because there's some discussion in the field about, if it's a baby, we can't really tell what their vision is. So why would they need a TVI? We don't need a TVI till they're older and they can tell us what they see. In your work with parents, do you think that why do you tell them it's important for them to be connected with VIPS?
I think it's important because it can affect your global development. Like it can affect your gross motor, your fine motor, things like that. But I think overall, just as someone who talks to parents, the main thing people say when I talk to them is, I don't know what my kid sees. I don't understand my kid's vision. Answer the basic question, when you watch your child, what concerns you? And sometimes they're like, well, the doctor says it's this, but I think they look fine. And so I think that having someone that specifically understands vision can be there to help you navigate the future, and also know when something comes up that isn't normal, because you just don't know. Every child is different, whether they have a visual impairment or not. All kids are different. So is my kid doing this something that's a concern? Like if they're only responding to red, is that a concern, or is red their favorite color? Like you don't know unless someone tells you these things.
I would also like to add, I feel like we maybe have all talked about it, but if you're a family listening and someone tells you, oh, well, your child's really young and we don't know what they see, and they kind of brush you off, like, don't take that for an answer. Like, you have already heard Jenny and myself talk about, when you are looked at in a clinic setting, yes, that needs to be done for certain reasons, but as far as function goes, honestly, I'm not going to say it doesn't matter. It does matter, but we're looking at functional vision, and we can observe your child and learn about what they can see. Maybe we're not going to be able to know if they can, pick out specific details that require us asking them questions, but we can get a very good idea about how your child uses their vision in terms of their developmental skills for what their age is, because they give us some really good clues about that. So don't ever don't ever be satisfied with, well, your child's really young, we don't know what they see, because we do know what they see.
Yeah, and starting from the beginning is always, for me, I would rather overdo than have to play catch up. So if I have missed early intervention of any kind is essential. But if someone told me they don't know about my kid's vision and now they're 3 and we realize it was a problem, now I'm playing catch up. where I could have said, I would rather just have the insurance on this and, get started.
And I can tell you, and we'll talk about this more in another episode, so here's a teaser, is we're starting to do some research on early functional vision screening for babies who are 35 to 40 weeks. So that's in the NICU. That's preterm. So they are giving us consistent answers, and we're able to see that functional vision. So what Paige said is true, that we can tell what they see and how they're using their vision. And so you need to seek out that help. All right, I think that's it for today. Thanks for listening about assessment and evaluation, and for sure let us know if you have any questions.
Thank you so much for listening to Feeling This Life. Please consider subscribing to Feeling This Life wherever you get your podcasts. And please take a minute or two to give us your feedback and your ideas for future episodes by completing our survey, which is linked in the show notes. There, you'll also find ways to get in contact with us, and you'll find resources related to today's episode. Please join us again next time for another episode of Feeling This Life.